Hello, I'm Jae-Chan from Asan Medical Center, South Korea. It is a great honor to make a presentation in Korean Journal of Radiology. I will present about the lens dose reduction study, which is named Reduction of Radiation Dose to Eye Lens in Cerebral 3D Rotational Angiography using Head-Off Centering by Table Height Adjustment, a prospective study. This study was co-authored by Professor Yunsun Song from Asan Medical Center. Cerebral angiography and 3D rotational angiography are frequently used in these days and the gold standard imaging method for evaluating neurovascular disease, including intracranial aneurysms. However, 3D-RA entails additional radiation exposure, therefore should be used with caution. On the other hand, the lens is one of the most sensitive organs to radiation exposure. Therefore, ICRP recommended to limit the radiation dose of the lens. Many previous studies have investigated different protocols for reducing radiation doses. However, few papers focused on dose reduction in 3D-RA and non-specifically focused on reducing the lens radiation dose. A phantom study in CT showed that head mid-centering, also known as off-centering, may be effective in reducing the radiation dose to the lens. The purpose of this study is that the radiation dose in 3D-RA to the eye lens could also be reduced by intentionally off-centering the head by adjusting the imaging table height. We performed both phantom study and patient study. A Lando head phantom was used in the phantom study. The center of the head was the reference FOV, and 3D-RA was performed once at every 1 cm change in the table height. Measurement of lens radiation dose was performed by photoluminescence dosimeter from Japan. We selected this device because of its low angular dependence, wide range of dose measurement, and convenient size for examination. Transparent goggle with 3 PLDs in each pocket was used to estimate the radiation exposure to the lens. Radiation dose, air kerma, and kerma area product were measured. In the patient study, we prospectively enrolled patients who meet inclusion criteria. Patients who underwent cerebral angiography for diagnosis and pre-treatment evaluation of intracranial aneurysms from June 2022 to July 2022. Among them, patients who have lesions in both anterior circulation cerebral arteries and need to perform 3D-RA in both ICAs were included. Patients with under 18 years or over 80 years old, patients with unexpected another vascular lesion, patients with devices that can affect the dose including coils, clips, or embolic substances, and patients who refused this study were excluded. During the 3D-RA, the lens dose reduction protocol was randomly applied to one side, and the conventional protocol without table adjustment was applied to the other side. In conventional protocol, FOV was located at the center of head in the AP and lateral views. Consequently, all intracranial arteries were included. On the other hand, in lens dose reduction protocol, the table was raised, and the anterior end of FOV was located just behind the choroidal blush. This is the real application for lens dose reduction protocol. In Figure A, an imaginary circle was drawn along the choroidal blush after cerebral angiography. Figure B shows that the table height was adjusted until the anterior end of the FOV was moved to just outside the circle, which was an increase in the table height of about 2 cm. Figure C shows that the FOV of the first 3D reconstruction, and Figure D shows a representative case of intracranial aneurysm using the conventional and lens dose reduction protocol. This is the video to help you understand. I'm going to explain how to apply the lens dose reduction protocol in 3D-RA through this video. First, perform an internal carotid arteriography and check the location of a choroidal blush. And mark the choroidal blush with a circle. Then, after collimating the FOV in 3D, Raise the table to align the front end of the FOV right behind the choroidal blush, using the marked circle as a reference. After obtaining the 3D, the FOV was manually reduced to improve spatial resolution, and interactive reconstruction was performed. Then, final volume reconstructed image was obtained like this. This is the result of our study. In the Phantom study, the radiation dose to the lens decreased by an average of 38% per 1 centimeter increase in the table. In the patient study, a total of 20 patients were included in this study. The lens dose reduction protocol was randomly applied to one side, and the conventional protocol without table adjustment was applied to the other side. The mean age of the study was 58 years old. Since this study was performed only in patients with cerebral aneurysm, the proportion of women was high. 9 patients had only one aneurysm, and 11 patients with 28 aneurysms were found. Most aneurysms were located in distal ICA. When we compared the two groups, there was significant difference in lens radiation dose between conventional and lens dose reduction group. The radiation decreased in reduction group about 83%. On the contrary, there were no differences in air kerma area product, and imaging quality analysis between the two groups. In conclusion, the strategy for reducing the radiation dose of lens is simple. Just adjust the height of table. Lens dose reduction by intentional head-off centering was feasible in clinical practice. With subtle adjustment of table height, it would be possible to reduce the radiation dose of lens by almost 83%. This protocol can be particularly beneficial for patients who require serial DSA examinations. Thank you for your attention.